Woohoo!
All right. Hello. It's Dr. Sonya Doherty, naturopathic doctor from Exceptional MD, and I'm here today with Dr. JJ Dugoua, who has his PhD in pharmaceutical sciences and is an amazing, exceptional naturopathic doctor who's
Thank
in,
you.
does a lot of integrative care, a lot of complicated cases, a lot of infection based chronic concerns, cancer management, co-management, or whatever the
Yeah,
right term is. I don't work with cancer patients, so I know it's
yeah,
supportive care, I think is the term, right? Is
yeah.
that
I think they like adjunctive is the current word
adjunctive? There you
to use.
go.
Adjunctive because it just
Yeah.
rolls off the tongue. Adjunctive. Yes. Yeah.
And has been a graduate of CCNM for 20 years, right? Because we graduated
Yeah.
together. And
Yeah. We're going
for
together.
those of you who don't know, JJ and I were office mates. So we've been,
Yeah.
yeah, troublemakers for a long time.
We've been causing trouble for a long time.
Yeah.
Actually, we had I ended up with the fridge when we moved out of CCNM, and I had that fridge until about 3 years ago, and it lasted like
That's
because
amazing.
it was already a hand me down from I don't know who gave it to us or we bought it from someone, and then it was a hand me down, and it was good. It was, I mean, it was dented. I think we got it dented, and yeah, it was good. It
It was
was
an
good.
exceptional fridge.
It was an exceptional fridge. Exceptional fridge. Thank you, CCNM, for the fridge.
Oh,
I
those were
guess.
fun years.
I guess. Yeah, that was hilarious. Oh my God. Some of the stories you just can't tell, but yeah, it was pretty
No,
fun.
yeah, we can't.
Yeah, we can't tell. We can't tell.
No, but it's great. It's one of the best things about Exceptional ND for me has just been reconnecting with old friends and colleagues, and
Yeah.
not surprisingly, learning how amazing the things they are that they're doing, but learning the details of it has been awesome. So JJ spoke to our Exceptional NDs during our cancer intensive month and presented some really
Mhm.
phenomenal cases. So yeah, like just love to
Yeah.
hear what you do in practice.
Sure, sure. I mean, so it's funny. So you and I were just speaking at the Collaborative Education, which is a
Mhm.
great conference. Well, yours is great also too. I mean, you guys did yours in November, in person.
February. Yeah, February in
Oh God.
person,
Oh
clinical
yeah, you're right. It was
girls.
this year. Okay. I know, whatever. Just it's Friday, brain
Yeah.
fart.
Yeah.
So yeah, so we just presented together, and it was nice to hear what you're doing too. I mean, stuff you're doing is bananas, Sonia. I mean, hats off to you and hats off to your sister. You guys are doing really, really good stuff. And it's interesting, I mean, I used to work with Natasha Turner, and I remember she came. Her and I were chatting once. We worked at a health company and really practiced together. And she said, "You know what? I like chatting with you because you look at things differently, and that's why I like listening to you because you look at things differently, right? So, and your sister too. So you guys have a different take. And Paul Anderson looks at things differently. Paul
Yeah.
Saunders looks at things differently, right? So, because sometimes you're like, okay, I know that magnesium is going to fix this constipation case, right? Or I mean, I saw this guy a few minutes ago that, he had blood pressure issues. I'm like, oh, do a little bit of ribose, do a bit of hibiscus, do a little bit of magnesium. That'll probably do the trick. But when you see these different perspectives and you hit a wall and you're not getting any improvement, then you're like, oh, Sonia has this perspective of doing it this way, working the mitochondria and making them poop, and stuff like that, right? So I'm like, yeah, maybe I'll try that. So it allows you to kind of borrow from different people and just kind of sort of borrow their thought process, plus or minus, and I mean, hopefully get some good results. So yeah, that's great. So anyway, I forget where I was going with this. I just kind of went on a tangent,
Well,
but
you're saying how great I was, which I'd love to
yeah,
hear. So I
exactly.
didn't
That's a great
I
tangent.
didn't
Oh,
I didn't give you the agenda for the interview, but you're doing great so
yeah, no,
far.
that's fine. That's fine. We don't need an agenda. We could
No.
we could just wing it.
Yeah.
So yeah, so I mean, so right at the conference, right? Sorry, I went on a brain fart. So I was chatting with one of the fellows there, and he just asked me, he said, what do you see? And right, like what Sonia says, I do some adjunctive cancer therapy. That's the word now. I mean, I've been seeing cancer since I think 2003, 2004. I see some early in my career. I saw some cancer patients. So I don't just do that. I don't just focus purely on adjunctive cancer, just because frankly, it can be depressing. You do some
Mhm.
great work, but it can be depressing. And I get used to the people and I feel bad, if they die, right? So it's hard.
Yeah.
So I don't do too much of it. I mean, I have a, autoimmune condition and pseudo remission. So I've always been an autoimmune guy. And just lately, because I think, at least in my case, some of this autoimmune stuff is due to infections, I've become an infection guy. So what draws people to me is they like my pharmacy background. I'm kind of like the entry point of someone who's like, oh, there's all this like hokey stuff out there. Let's go see this guy. He's got a PhD in pharmacy. He's kind of he won't like put me on stuff. He'll know and then I'm kind of the entry point, and they can be more complicated. They're usually more complicated cases. And then, then we chat about stuff, and I'm like, yeah, I want to take some arnica. I'm like, oh, okay. Well, if he says homeopathy is okay, then I must be okay, right? So it just, and then you just kind of build rapport and you build trust, and then then the patient starts to, see improvement, and then the relationship grows and the patient gets better, right? Yeah, right. I remember, one of the things I actually wanted to talk about today is, I mean, especially if someone's like a young ND listening to this, it's like CCNM, I think, did a decent job on us. I think CCNM did a decent job. There's some things could have been done better, and some things, were done quite well. I mean, when I compare us to the other schools, I mean, I think we were chatting with that Nova Scotia guy right on the weekend.
Mhm.
What we do the best at CCNM is that we're generalists. We have a little bit from everything. We've got the BOD, we've got the homeo, we've got the TCM, and so on. Where some of the other schools don't have that as much. But it also teaches us some bad habits, and that's the thing that you have to just train out of yourself right off the bat. I mean, maybe just the way nature, I mean, the way that the nature of the clinic is run, or just the philosophy of the supervisors. But you have to get results. Someone's going to come and see you. They're going to spend an hour with you, an hour and a half. You're going to charge them a couple $100. You can't, not treat on the first visit. You have to have them see some kind of hope, right? I mean, obviously, if it's something that they know it's the long term, and these are usually the type of patient that will say, listen, you know what, I know this is going to be an ongoing issue, from an autoimmune condition to arthritis to whatever, but I'd like at least my bowels to move, or I'd like to sleep better. So if it's your first visit and someone's bombarding you, they're coming in with, like, the 1 inch stack of reports, which they've either emailed you literally like 30 minutes before your appointment, then they're like, hey, have you had a look at this? And you're like,
When,
no.
when, when, when would I have?
Like, no, I was with someone else right before or they bring in the stack, and then you just see like oats tests and food sensitivity tests, and labs and labs, and you've got like 3, 4 years of labs, and you're like, and you're losing your mind. You sort of try to pick an easy one. Try to think, you know what, okay, I could fix this guy's bowels, or this lady's bowels. I could get them to sleep better. I could just try to bump up their energy in the morning, so at least they've got better energy, better cognition, like an ACAR with a carnitine type of thing. That's usually a pretty easy way to kind of get some improvement. So they see a glimmer of hope, and then you build some rapport. They think, okay, it's not just this guy knows what he's talking about. He could probably help me. And then they're buying in. They're able to they want to do more. They want to try more things. Because I mean, if you're doing a heavy metal thing, it's like a year. Some of the work you're doing for your stuff, I'm sure you're looking at years. Diet changes, fully repairing the gut. I mean, some of the stuff you're doing takes time, right? So you have to have, there's got to be a rapport. There's got to be some kind of confidence that you know what you're doing. So if someone comes in right off the bat and you're like, oh, here's a diary, I mean, that's not going to work, right? I mean, you have to show them that you're able to do something for them and give them a little bit of improvement. So I mean, that's one of the things that, I mean, I found with us, they wouldn't let us prescribe on the first visit, which I thought was ridiculous. So you have to think of, you pick through the chart. If it's pretty straightforward, then great, just treat right away, and you could probably address the whole thing. But if you feel overwhelmed, at least pick what you think will be an easy one. And in some cases too, like just sending out for testing, that's totally fine, because the patients will be like, you know what, he doesn't really know what I have, waiting for testing. That's totally acceptable. But you have to kind of give them something than just like a diary or something like that. You gotta do something.
I totally agree. Chris and I talk about this all the time about how to get results in a first visit. And that's why I love B12 injections, particularly for the
Yeah.
population that I work with most of the time. It's getting a little bit less reliable now in all the like post-COVID years with, all the inflammation. And I think COVID sort of confusing and messing up the mitochondria, that kind of stuff. But often
Mhm.
the B12s, it's a home run. And you mentioned Brian Ray from Nova Scotia, who we were
Yeah,
speaking with at the conference, and he feels
yeah.
that way too. I mean, I don't want to speak for him, but B12 can be a big home run for my population. Dick
Mm.
Tom, talks about the basic treatment guidelines. I don't know,
Yeah. Yeah.
yeah, he posted them the other day, lifestyle things like, grounding and castor oil and diet and water, B complex, just sort of starting the
Yeah.
process of getting people on the right track, which does take years. But to your point, it's relationship based. Like they're going to come back to see you because you've built that trust in that relationship. So and you're really talented at that, like, meeting people where they are and bringing them along and connecting with them. And I think
Mhm.
one of our supervisors, Dr. Rickford, right? He talked a lot about
Yeah.
like its relationships. And
Yeah.
remember Dr. Timothy talking about how to take a case and taking, the detailed information so that when someone comes back to you, you can say, hey, yeah, I know, like your energy was 2 and now it's a 5, or you weren't
Mhm.
sleeping, now you are
Mhm.
sleeping. Because I know sometimes that piece too is you have helped people on the first visit, but because they are so overwhelmed by other things, they may not realize. So then you can prompt them and say, hey, your skin's better, your sleep's better, you're not having those headaches daily. And then it's like, all right, keep
Yeah.
keep them. I like what you said at the
Yeah.
conference. I think it was a reassure and reiterate. I
Yeah.
think I love that. That was great because it
Mhm.
is,
Mhm.
especially in chronic disease, just keeping them going in the right direction.
Yeah, yeah, it's coaching. I mean, I don't, I mean, it is coaching. I mean, I know coaching is also like, a nutritional coaching too. What do we do is, we're kind of we're beyond that, but we are still coaching, right? And I remember I used to do a lot of preceptoring with Andre Sen in Montreal, and he basically the way he set up is he had his he ran all the rubrics, and then he had a screen where the students would watch, and you kind of watch what he was going through the rubrics and how he would chart. And he would try to always write reassurance. And I'm like, oh, that's interesting. And like reassurance. And I'm like, that's interesting. So that's where it comes from. I can't even take credit for that. That's from him. He's like, you're just reassuring the patient. Like, yeah, you're on track. This makes sense. We're doing that. You've seen some
Mhm.
improvement. Look, this was, this is like what you're saying. Like this was a 2 out of 10. Now it's like a 0 out of 10. Your problem, this problem's gone, that problem's gone. Just you keep reassuring them that they're on path. And what you mentioned too at the conference about, I think Dick Tom's the river, right? Where do you want to be, right? Do you want to
Mhm.
be at, it's the beginning, da da da, and then the mountains and so on. You're like, well, listen, when I got you, you're like right at the beginning, and now we're getting to the mountains. So I'm
Mhm.
like, oh yeah, you're right. You remember that? It was like, oh yeah, eczema was terrible, and or my acne, you can even see my face, and now it's like I get zits, here and there during my period. Oh, that's great, right? So it's no, it's relationship building. So,
Mhm.
and that's just basically being a good listener, and I guess, I mean, yeah, just being a good listener and basically just being a good problem solver. And that's where, your idea of the B12 or the 25,000, right? I think you guys are doing. Yeah, I
Mhm.
was actually thinking about that. It's one of the things I've actually been meaning to roll in. So I meant to do that this week, but I got sidetracked. That's the thing too, is that you get so set in your ways that
Mhm.
it takes a little bit of time to incorporate these changes of things you want to try. Right. So I mean,
Yeah. Yeah,
yeah.
especially when you're not used to maybe how they're going to react, and then you're fielding more calls or emails because something pops up that you're not already used to, right? And
Yeah.
I mean,
Yeah.
aside from just really, loving you as a person, and you're such
Thank you.
a great person and a phenomenal naturopathic doctor, the
Mm,
other big reason I wanted to interview you for this exceptional ND series is you're treating really complicated things, and I feel like other
mhm.
naturopathic doctors, particularly the younger ones, I think they need to know the power of naturopathic medicine if they don't already. You're
Yeah.
treating extremely complicated patients and you're transforming their lives with the tools that
Mhm.
we have in our toolbox. And you also have your PhD in pharmaceutical science. So I'd love to
Yeah.
hear your thoughts
Yeah.
on evidence-based medicine and the role
Yeah.
that that plays for us as naturopathic doctors when some of our tools aren't as sort of robustly investigated with our CT trials and that kind of thing.
Yeah, I mean when I first started practicing, I think our treatment guidelines, I mean when they were more evidence-based, were basically, what was the wording? It was basically ideally evidence-based or evidence informed, or you had some kind of physiological rationale or you have a case history of it, or not case history, you have what's the word I'm looking for? It's
Anecdotal, I think,
anecdotal
experience. Yeah.
anecdotal experience, right? That it's worked. So I know as as this evidence-based medicine has evolved, they don't like this anecdotal stuff because they don't view it as scientific because there's no clinical trials and so on. I mean, yeah, the trials are there are there for the broad strokes, managing a cholesterol, managing the more kind of straightforward stuff. And true, maybe berberine will kill most things, maybe a fish oil will, I don't know, increase most HDLs, but when you do, when it doesn't, and a lot of times it just doesn't. So that's when you have to really dig and think outside the box. And the data, does it matter? Does it not matter? I mean, I think you and I were chatting about this. I mean, there's a fellow, Dr. Brad Johnson, who's like, he's fully clinepi right now, very successful, just does clinical epidemiology, and he's in Texas, a smart guy. And he asked me, he said, listen, I mean, what do you think about just setting up a clinic where it's just the evidence? Patients come in, you just give them the best evidence. And I said, dude, I said, patients just want to get better. I mean, they don't give a shit if there's a meta-analysis or an RCT, or you have like 85 RCTs or two, or they don't care about the p-values. They just want to get better. They just do not care. They just want to get better. Data to them. Sometimes it gets some people are like, well, what about this? Da, 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 right? Fair enough. And there are some of those patients, and they're a little bit annoying, but but for the most part, they just want to get better. So if you're doing like a homeopathy, or you're doing a drainage, or you're basically using, there's a kid screaming in the room next door. Do you hear that?
No, I can't. No.
Oh, okay. All right, we have a pediatrician that's in the office next
Oh.
to us, and I think he's probably some kids like, don't take me in there. I know, I thought you could hear that. I know, it's a really loud kid screaming on the phone. So, just lost my train of thought, but yeah, so evidence. So the patients just want to get better.
Yeah.
So in terms of how I steer, it just so right off the bat, see what's most pressing to them. Like someone could be coming in with like lupus, and they've got colitis, they've got a ton of problems, they're in an agony, but they're just like, you know what, if we could just fix my bowel, at least get me bowel movements every day, I'd love that. I'm like, okay, great, let's fix that. That's easy.
Mhm.
That's magnesium, right? That's an easy win. Some of the stuff you're going at the cause, or so you're going at the cause, but on the first visit, you're like, this person is so inflamed, they're not sleeping, their relationship's going to hell, they can't work, right? Just like, I can't get at the cause right away because the patient just can't tolerate the treatment. We've got this one lady now that, I mean, she's in a wheelchair. When she's like moving around outside the house, she reacts to so many things. She's reacted to so many antibiotics. She has quite a lot of infections, and it's like a game of chess. You try for some improvement in symptoms, and you're like, okay, well, she's got this infection. Let's try to kill it. Oh crap, it's flaring. Okay, let's repair. Let's back up. All right, now let me try this. So then, your talk and Krista's talk was good because it was a good reminder to just keep working the mitochondria, right? Because as you're trying to get them to get stronger to be able to tolerate some of the treatments, a lot of the stuff we're doing is kind of working on the mitochondria. So I really enjoy that on the weekend.
Thank you.
So I mean, so for complex cases, it's I guess it's just kind of an instinct. Like if someone's complaining of something that's really bothering them, and then their period is really setting them off, I'll be like, okay, well, your hormones are almost like a separate thing. I mean, do you want me to tackle that, or do you want me to just wait until we get more stability there? You just sort of let me know. So I sort of let them steer, and then they'll usually say, yeah, we got to fix the hormones right off the bat. I can't do it. And I'm like, okay. That it might mean that your joints might hurt for at least a month or two, maybe, or a little bit more. So I sort of let them sort of steer at the same time, but I guess it's just a question of just the patient will sort of give you the answer, right, in terms of where you should be starting. I find a lot of the times, but yeah, but it's complicated. It's
Yeah.
complicated now, and I mean, you need, and I find too, I find I need help. I mean, two things that I find kind of save my butt and allow me to not get stuck is one, a nurse practitioner, and two, an osteopath. So a nurse practitioner, just some things we can't order, right? So I mean, I can't order. We could say whatever we want, right here, right? So we could say like product. We could say labs, right?
Oh yeah, yeah. No, this is
Okay.
just it's just yeah.
Yeah. We're not like censored or anything like that.
Nope.
We'll see credits. So like the lab in Vaughan, I don't know if you guys use them or not. You guys use Health Genetics Center in Vaughan?
I've heard of them, but I don't use them. No.
Okay, so they do a lot of they do like real-time PCR testing.
Okay.
So we can't order that. So so if someone comes to you and it's multi-system, it's usually an infection. That's kind of my experience. They might have some chills, they might have maybe a little bit of a fever, some joint pain, they've got some weird neuro stuff, they got some digestive stuff, some mental stuff. You're just kind of like, it kind of feels like an infection. So usually when it's that I usually send them for these guys will
Mm,
test. And they could basically test like most body fluids, like so nasal swab, throat swab, vaginal swab, semen, urine, and when you suspect the infection, there's usually something there. But I can't order that. Microgen DX in the US is dynamite. They're a great lab that they do like PCR testing. They'll do some great like for chronic prostatitis,
mm,
chronic cystitis. They do a lot of arthritis panels and so on. Again, I can't order that. What else? Mold testing, I can't order that.
mm.
Dr. Arman, who's great, by the way. I mean, he actually answers his emails. I mean, he's
He's
wonderful.
great. Yeah, he
He's
is.
great. Yeah, he's awesome, right? Like the
Hmm.
guy's like the guy answers you in like an hour, right? Like it's like
He's very dedicated. Yeah, he's very smart, very committed.
yeah, like the
Yeah.
guy doesn't sleep, so we can't order that. So I need the
Yeah.
nurse practitioner, and then sometimes, and as I talked about in the talk, I know it's not very naturopathic, but I mean, like, an example, I had this like 22-year-old lady, and she's 27 now, and she's pretty much in recovery now, but she had an infection. Well, no, she came to me with like just spontaneous arthritis. Wasn't exactly RA because the rheumatoid factor is negative, but it kind of looked like RA or more of a reactive arthritis. Had to come off work, worse during her period, started gaining weight, couldn't sleep, pain, like just, I mean, tack, just so many symptoms. I was like, this is too many systems involved. I think it's an infection. And we got her GP to order this Health Genetics Center testing, which is rare. And sometimes they will, but he was hitting a wall too, and he really wanted to help her, which is really nice. So he ordered the testing, and we found chlamydia pneumonia.
Oh,
Uh,
wow.
and it was like, she saw me, it had already been a number of months. And I'm just like, you know what, let's just do the doxycycline. So
Yeah.
GP ran it for 3 weeks. I'm like, she needs to, you know, uh, naturopathic principles aside, she needs to feel better. She needs to feel better. Let's just run the antibiotic and then we'll do a probiotic, away from it, and then we'll just repair after. So it took her, I think, 2 or 3 runs of 3 weeks, and we did some repair in between. And she was basically spending the whole day in bed. And then she basically started getting out of bed. And then bit by bit, she started kind of recovering. But now she has a residual autoimmune condition from it and so on. So I need someone to order these drugs because I can't. And sometimes the GPs won't order this type of testing. Sometimes the GPs are, they'll just do like, 7 days of doxy, which I don't
Mm.
think is enough. Right. So you need someone to work with us that's able to kind of do these things because it's off scope and we just can't. There's just no way around it. And the other thing, I mean, do you guys use a lot of osteopaths?
I
Like
recommend
osteopaths?
osteopathy a lot. I have
Mm.
ones that I refer to locally, and because my practice is so autism based, like I have people from
Right,
all over.
right.
So I recommend find a good osteopath, work with
Mm.
your nurse practitioner or your physician.
Right.
Because one of the number one causes of behavioral concerns in autism is the stool loading, like the fecal loading, the bowel issues. So
Mhm.
usually the first thing I'm asking is for them to go talk to their medical doctor about getting a requisition for a KUB bowel x-ray. So that's
Mhm.
great because then the doctors start seeing that there's a connection between the gut and the behavior. And then when that child gets better, I mean, they're kids who hurt themselves and hurt other people. They get better, everybody notices. So I feel like good medicine's good medicine, whether it's natural or not. And if someone
Yeah,
needs an
yeah,
antibiotic, to your point, they need an antibiotic. If they need
yeah, yeah,
yeah. So it's we have to do the best for our patients. And I think the more reaching out we do to other healthcare professionals, the better our patients are cared for. And then it also helps naturopathic medicine, right? Because I think we get, you know, for various reasons, like some medical professionals don't know what to do with us, right? Because
yeah, yeah.
we do all practice differently. So that's a bit hard to kind of figure out.
Yeah, I mean that is a fair point. We are a pretty eclectic bunch, right? So and we kind of run the gamut. So no, it's an absolute fair point. I mean, I have a hospital shift for, I mean, since 2004, 2005, I forget, at Toronto Western. It's an artist clinic. It's a subsidized artist clinic. And so I've been working with the GPs and family medicine for a while. And at first they were a little bit resistant, and they'd bring me reports, things like hair analyses and red paw, which I'm not a big fan of red paw. I'm not a big fan of hair either. And I'd be like, yeah, no, oh, this, yeah, okay, maybe. So we'd have a conversation.
Mhm.
And because I was already working, for working through the hospital, they were more open to the conversation, right?
Mhm.
Like I did a few ground rounds, and I remember the
Interesting.
first ground rounds are talking about herpes, of course, had to be herpes, and just because they like herpes. And they're talking about, like, what is it, valaciclovir, cyclovir, whatever, and then I'm just listening. I'm like, oh, well, this is super interesting. Da da da. They're treating this, and the dosing, and they're pulling out cases, and then they just say, oh, well, let's see what the naturopath says, and I'm like, huh, what? And I was like, oh, off the top of my head, I'm like, yeah, lysine, woohoo! And then they're
Mhm.
just, oh, okay, lysine, interesting. So, and they were receptive to it. So, and we share a lot of patients with some of the GPs there, and then the
Mhm.
comments I'd get from the patients would be like, yeah, they kind of like you there, because they find, like, you don't ask too much, you don't ask for too much testing. They find a lot of naturopaths ask for a lot of testing.
Mhm.
I get that too from patients when they say no, right? If their doctors say no, like, oh, this naturopath's asking for too much testing, etc. So, and also too, they said my requests are reasonable. So it's good. So it's just, even if we disagree, we're still able to work together,
Yeah.
right? So, and even same thing with the pharmacists too, man. I really encourage people to talk to their pharmacists. I
Yeah.
found them very receptive to naturopaths. I mean, what 10% of a pharmacy nowadays carries vitamins. So, I mean, they're obviously getting questions about it, so they're pretty
That's true.
knowledgeable about it, right? And you ask them questions, I mean, I find them pretty receptive to us, and that's how, again, you start to bridge the gap, right? So even drug questions, I'm like, yeah, the GP gave him this dose. Is that a bit high, or da da da? I'm like, oh yeah, no, no, and then they
Yeah.
could reach out to the GP and adjust it, right? So sometimes the dosing is off. So.
Absolutely. Yeah, I think if you're patient centric, I love it. So, yeah, this
Yeah.
has been awesome. So relationships huge, getting results huge.
Yeah.
What else, sort of as a last thought here, we have
Yeah, I mean, work with an osteo. So, I mean, oh, you're right. So when you get stuck, osteos, very good craniosacral. I mean, especially for your kids, right? They
mhm.
they probably have cranial lesions, right? Like Tima Stein, which she did a ton of stuff in kids, and I think she's retired now, but her daughter still runs the show. But I mean, the kids are born and their plates aren't moving properly, so they get a lot of pressure. They also just don't believe the plates in the head fuse. So they believe you could kind of manipulate them and release the pressure. So really remove cranial adhesions.
Mhm.
Also, too, if there's any type of surgery or inflammation, you'll have like bowel adhesions. You're getting someone who's having peeing all the time or urgency, and there's been any type of pelvic issue, there's probably some kind of adhesion. An osteo can usually release that. We could do
Okay.
castor oil, but the osteos are great at doing that.
Yeah.
Another thing too, I'd also add too, I guess, to my wheelhouse is the pelvic floor osteo. I've been sending a lot of people for that. I've been finding it's been helping. And I guess you probably wouldn't be doing that as much in kids. Uh, yeah. So, but that's been helping too. I mean, I've got ladies that after, I mean, you name it, childbirth, sports, car accidents, they're having like bladder issues. They go see pelvic floor physio, and they don't need to wear a diaper. I've got
Yeah.
guys who pee 6 times a night, and now they're down to one or two, and we do the naturopathic stuff, the supplemental, reishi, et cetera, et cetera, et cetera. And then they're down to two, and they're like, this is awesome. I
Yeah.
wake up twice a night. I get 3, 4 hours pee, 3, 4 hours pee. I'm good. That's not bad. Beats
Yeah.
6, waking up every hour and a half, right? So,
Yeah.
so pelvic floor physio, and I found all these people. Oops, sorry, just moving something on my camera. I found all these people have been, very integrated, very easy to work with. So yeah, it's a lot of relationship managing.
It
So
is
yeah,
awesome.
yeah,
Well, thank
that's
you
great.
so much for your
Thank you.
time today. This was amazing, and looking forward to hearing you speak again. I really enjoyed it last weekend, and we'll
Thank you.
yeah, hopefully everyone gets a lot out of this interview and starts to, you know, put some of these ideas into play if you're not, or just as a reminder, right? It's as we've been practicing 20 years. So like you said, you
Yeah,
talk to
yeah,
the people who've been practicing a long time and reminds you to keep kind of moving forward. And we always say, like, for exceptional ND, our goal is clinical success, right?
yeah,
So
yeah, yeah. Well, thank you for having
awesome.
me. I think you and your sister are doing a dynamite job, and I look forward to seeing you guys speak soon. I don't know if you guys are speaking at the OND or not, or
I
you
think
guys.
so. Yeah, they're finalizing it right now. I'm pretty sure
Right.
we're gonna do pots and pans, but I think someone is gonna do pandas, so I think we might do pots and chronic infections or long COVID.
Oh, okay. Okay, that's cool. Okay, that's cool. No, well, thanks. You guys are doing a bang
Yeah.
up job. You guys are truly very successful, and you're getting great results in your patients, and with exceptional ND too. I mean, just having someone to mentor and coach you, and and all that stuff. What are you doing? I think it's great. So I think so. Hats off to you guys for doing that. It's nice. So good job.
Thank you.
Awesome.
Take care.
Alrighty, take care.
Bye.
Bye, guys.
Bye.